Dear audience, good afternoon. In the next few minutes, I'd like to introduce my PhD thesis titled The Association Between Fluid Therapy and Organ Dysfunction in Critically Ill Patients. My name is Ildikó, Szántó. I'm a first-year PhD student and anesthesiologist and intensive specialist in Nyíregyháza. I have a personal vision in my work to improve outcomes for critically ill patients, but it's not only a personal work. That's why I work with the best team ever, and our work's mission to identify the best possible therapy strategy that causes the least harm in critically ill patients. Now we have two ongoing projects which are very similar. We would like to investigate the effects of balanced crystalloids versus isotonic saline on organ dysfunction, first in patients undergoing major abdominal surgery and after in septic shock patients. Let me introduce a common background of this disease or this problem. Fluid administration is essential in hemodynamic stabilization, and in this case we use first crystalloid solution. In the crystalloid solutions there are two main groups, the balanced and unbalanced solution, as you can see an example on the picture. The problem is that 0.9 saline and isotonic saline has a concentration of chloride very high, which is about 50% higher than the concentration of chloride in blood or balanced solutions. And this excessive chloride intake can be very harmful for the patients, causing metabolic acidosis or arrhythmias. The other concern is giving the right amount of fluid. Fluid therapy is like an art or a double-edged sword. But the point is that both hypovolemia and fluid overload can be dangerous for our patients. As you can see in the picture, it can cause many complications, which ultimately leading increased morbidity and mortality. So let's have a closer look at our first topic, which will be a systematic review and meta-analysis. The problem with this population is the huge number of major surgery, which is further exacerbated by the relatively high complication rate associated with it. And we have some guidelines, for example, ERAS guideline, which suggests the using of balanced crystalloids as a first choice, but we have not enough evidence whether the balanced crystalloids or isotonic saline is better regarding the prevention of postoperative complication, and that's why our aim to investigate the association between intraoperative fluid therapy with balanced crystalloids versus isotonic saline and postoperative complications in patients undergoing major abdominal surgery. That's why our clinical question is intraoperative fluid therapy with balanced crystalloids more beneficial than isotonic saline in preventing postoperative complications. To answer this, we use PICA framework, where our population is patients undergoing major surgery. We compare balanced crystalloids with isotonic saline, and our primary outcome will be the development of postoperative complication based on Schweizwiedel's article. So we believe that using the balanced crystalloid solutions is superior to using isotonic saline to decrease the postoperative complication rates. And we see our worst clinical implication that using the most appropriate type of infusion in these patients, we can reduce the postoperative complication rates. That's why the related length of hospital stay and associated costs. We did our systematic search on the 10th of November with this search key and with these results, as you can see on the picture. This search key contains 4 domains. The first 2 domains include our 2 infusion type and their synonyms. The third is related to our population, and the fourth is associated with our intervention. First, we started about 2,500 articles, and after duplicate removal and title and abstract selection and full text selection, now we are continuing our work with 29 full text selections data extraction. We are doing this in these days. So let's look briefly our second topic, which will be the same with septic shock patients. And the problem is the population similar as the major surgery. The problem is the huge number of septic shock patients, and the problem is that we face them in our everyday clinical practice. And the improvement of healthcare improved the care of these patients, but the problem is that despite of this, the mortality of this disease remained very high. And we, according to surveying sepsis guideline, we have a weak level of evidence to using balanced crystalloids. But in this case also, we don't have enough evidence which type of infusion can better outcomes for septic shock patients. And that's why we want to investigate or determine what kind of infusion can be used for these patients to cause the least harm. In this case, we ask the question, does using balanced crystalloids decrease organ dysfunction compared to isotonic saline? We use also PICO framework, where our population is septic shock patients. We compare also balanced crystalloids with isotonic saline, and our primary outcome in this case would be the development of organ dysfunction based on SOFA score. And we hypothesized that in this case also using balanced crystalloids is superior to usage isotonic saline, and is associated with a decrease in organ dysfunction in septic shock patients. And our clinical implication would be that using the most appropriate type of infusion can decrease the organ dysfunction in these patients and can lead to a better outcome for these patients. So to summarize my aim, I would like to submit our first project in May 2024 and the second topic in September 2024. Let's finish my presentation with one of my favorite quotes. We are responsible for what we do and what we don't do. Thank you for your attention.
Again, excellent ideas and a very nice presentation, Ildi. Just to clarify it for myself regarding your first project, under your clinical question you are mentioning intraoperative fluid, and in your search key I could read perioperative fluid. So are we speaking here about intraoperative or perioperative fluid therapy?
We try, so there's no enough articles with only the intraoperative using of crystalloids or type of infusion. So most of the articles made a mix. So they mentioned once intraoperative, once perioperative. Sometimes there is the preoperative infusion giving of the patients. So that's why we use both of them.
How could you define the major abdominal surgery? What does major mean?
We will define as the articles which we find in this search. In this case, is the main decision was that the duration of the surgery takes more than 2 hours. Yes.
What is more important? How much fluid do you give, or what kind of fluid do you give? And sometimes it's very hard to decide how much fluid do you give. What parameters can you help?
It's a very hard and difficult question. I think both of them is important. Which type of fluid and how much fluid give the patient. The best answer, I think, as the patient needs. You have to give that kind of that much of infusion, but with the hemodynamic monitorization of the patient can be helpful. So you can see the CVO2 level or CO2 gap or lactate or yes, the tension of the patient. So you can see every little puzzle in this game, and that can helpful for you.
If not, do you use isotonic saline?
No.
Okay. Is there any situation where you would decide to use isotonic saline if you are outside of the box, outside of your hospital?
No, we have some isotonic saline, but we use in a very narrow range of the patients. There are one guideline which suggests using isotonic saline. This is a diabetic ketoacidosis patient who you should have use isotonic saline. I don't think that it's okay, but the guideline says that. And the only case when I use isotonic saline is when I know the patient is hypochloremic, as after a severe nausea or vomiting or diarrhea, and that's the only case when I use the isotonic saline.